It's Fran. Good afternoon, everyone. Okay, so my case should be coming up shortly. I just want to commend Aerolase for giving us such a phenomenal device. I echo everything Fran said. You know, I still get patients who say, Doc, I've been to doctors and they say lasers cannot be used in skin of color. And we know that things have changed. So I'm really thankful for this laser. We've got the first case, the first study I'm going to look at. Okay, so here I am. The first study I'm going to look at, it was a small study because for, as many of us can attest to, hair removal is a very emotional thing, or, you know, unwanted hair is a very emotional thing. Pseudo-folliculitis Barbae, and not just in men, but women, of course. And so we looked at a case where, so this is one picture before and after, 7 laser treatments, right? And as Fran said, the settings I find are quite conservative and very safe, but don't be afraid once you test them before to go higher, because oftentimes you can go higher, because remember, as you go along, the hairs get thinner and you need to go higher to get more efficacy. So I find oftentimes by the 3rd, 4th, 5th treatment, I can go at a setting 7 or 8 quite safely in skin of color. And even in, let's say, a skin type 5, you can whip out the 5mm lens quite safely as well. All right, this next case, again, she was very happy with her progress. This was after 2 laser treatments, and again, 21 joules per centimeter square and 25, 1 pass. I tend to do 1 pass with pseudo-folliculitis Barbae. I also use skin cooling. I know we say that you don't have to use it, but I find when you have those darker skin type individuals with the thicker hairs, you have to respect it. And remember, especially in men with the density of the hair, you know, they may have some discomfort. So I find the ice, you know, makes you feel more comfortable that your treatment is going to be safer, and it's even more comfortable for the patient. As the hairs get thinner, the comfort level is even better. Of course, with acne, you know, I don't really have to use the ice pack, but some patients just like it anyway. Okay, and this patient, another thing, again, I know we associate permanent hair reduction with lasers. We have to be careful how we use the word permanent, because patients will hold you to it, okay? We have to emphasize that, as Fran said, you know, I normally tell them a series of 6 treatments, 1 treatment every month or so, every 3 to 4 weeks. And then after that, maintenance looks differently for everybody, okay? Especially if they have that hormonal element. I oftentimes would test my female patients and refer them to be treated if needed for underlying factors. And manage expectations. So we have patients that may come back. She comes to us, she has PCOS as well. She comes like every 3 months or so for her maintenance, and that's fine with her. She, you know, it's great compared to the other hair removal method, so she's fine with that as well. And again, I was able to go use the 5mm lens in this patient. Okay, so we're gonna go into post-inflammatory hyperpigmentation.